Hey everyone, this is Chris, and you're watching I Have COVID. Today is actually day 8 in my isolation. I've had COVID for now 8 days, and I'm feeling pretty good. Today is my first day really with no symptoms. I woke up with a dry cough. Feel pretty good, feel energized, feel ready to go, and I'm looking forward to going back to a normal life. Today's episode, I actually have a special guest named Domingo. He is a healthcare specialist in Abbotsford, and he works with COVID patients. So he's going to join us in a little bit here on that. Before that happens, again, thank you to all the viewers. Thank you for everyone that's been tuning in. Would love to have your questions and comments down below. If there's anything in the next episode or two that you'd like covered, like me ask, I'll be talking to some more experts, and if you'd like to get some questions answered by them, it'd be great to have your feedback. So if you haven't subscribed yet, go ahead and do that. It would be great. It helps the channel. And also like this video and hit the little bell over there so that you can get next episode. So let's go right into it. I'll move into the interview with my friend Domingo. Thanks for watching. Hey everyone, this is Chris, and I'm with my friend Domingo, and he's going to share a little bit about his experience actually working in the front lines, and also his experience of getting the vaccination. So, Domingo, you also have a YouTube channel. What's the name of that again?
Yeah, you can reach me at youtube.com/Domingo channel, and I have a variety of content there ranging from tutorials and also other collaborations with other YouTubers, and also I'm starting to experiment with a lot of explainer videos. So if you're into that sort of thing, you can check that out as well. So youtube.com/Domingo channel, and I think Chris will include it in the description below there.
Of course, yeah, I'll do that. Yeah, Domingo, I've had a few YouTube channels, but he was kind of the first guy I talked to on how to do this all, so he's been a good resource. So I'm sure he's got lots of stuff on his YouTube channel too to help you out. Yeah, so why don't we get right into it and just kind of ask you, so Domingo, where do you work?
I work at the Abbotsford Regional Hospital. I am a healthcare assistant. I've been with them for approximately 12 years now, and yeah, I'm right on the front lines helping patients out.
So generally, who's your client base or your patients? What?
My client base is mostly the elderly, and it's also just a mix of patients that are in with underlying conditions and mostly dementia. And with the cases of COVID rising, it's mostly people that are younger with symptoms. And then there are some people that are asymptomatic as well. And also there are some that are like really young that are just being screened for it. So we have a lot of different cases. There just varies between person to person. The youngest person that we had at the hospital, I know, was about 29, and they had symptoms, so it was pretty scary.
So you're not just working with the elderly; it's all kinds of different people now.
No, it's all kinds of different people. And one experience that I've had was a patient that has 2 kids and a spouse with COVID-19, and he ended up in the hospital, and he was just like this massive 6'7" guy, and he couldn't even breathe. That's how scary it was. Like, he was just struggling to get up, struggling to go to the bathroom. It was just a big, big mess. Like, he could like play football. This guy was so big. Like, yeah.
It's just strange how it hits so many different people in a different way.
Yeah, and it really hurts the lungs the most because COVID, once it gets into your system, it like spreads to your lungs. It makes your muscles ache. It's a whammy. Like, it just does a lot to you. So
yeah. So is that generally most of your patients right now are in the core, like with COVID, or?
Yeah, most of the patients there are with COVID, and then there are some that are being screened for it. So they've had their first swabs done. The nurses do the swabs for them, and then also after they get the results from the first swab, then they have to get confirmed, and then they do a second swab to confirm that they have it, because some people can test positive but end up negative, and then there are some that can show negative but unfortunately end up in positive. So that's why they got to do the swabs more than once, so that way they can get accurate data. So
yeah, we've had clients too that have been inconclusive several times, but because they were in contact with people with COVID, they just assume they're positive and they got to do the 14 days. So
precisely, yeah, they have that isolation period, and it's like one of the hardest periods for them because these are people that are like very social and very outgoing, and then just to be in this little private room that's like a tiny little box, it's just scary.
Do clients, are they by themselves in the room, or do they have a few people with the same COVID?
They do have to isolate basically, and for family to bring them, like, let's say personal effects and stuff, they have to call the front desk and they drop it off at the main entrance, and then we just send somebody down to get the stuff, and it's all tied up in a bag with their name on them, and then we bring it to the room, and then they can just open it up from there. So most of the time, most of them have phones. They can do FaceTime with them, but then there are some that don't even know how to use phones. So they're just pretty much relying on, like, I even saw some of them with old flip phones. So they're pretty much just using those to call their, like, aunt, uncle, or their spouse. It just, and some of them don't even have that stuff. So they have no clue how things are going. So.
Yeah, a lot of times when this happens, I don't know for your clientele, but the clientele we were working is they would get sent us so quickly that all they had was the clothes on their back. They didn't get their phone or anything. So they just show up and they're expected to live in for the next 14 days that way. So unless somebody brings them stuff, they're kind of just. Yeah,
that is truly challenging. Yeah.
Yeah. Cool. So what have you learned through this whole experience while you've been?
Well, from my experience, when the pandemic first arrived, I was a little nervous at first because this was all new to me, and the hospital setup was all new to me. There was new protocols, new policies, and just new things that we had to do. Every room had like a green sign on it that says you must gown up and glove and PPE before you enter, and then take it off when you exit. And we had to do that every single time. And that just sort of was like this sort of routine that we had to do. But it was just like, Dimi, it's just, we got to do it, but it just gets a bit annoying. But I had to really dig down and pray and let God speak to me, because there was just so much that I could just complain about. But then there was just this one moment in the shift that I finished that I was like, you know what, God, thanks for keeping me alive. Thanks for allowing me to help these people out, because I'm a man of faith and I believe that God does save, he does help, he does take care of you. Yeah. And most people don't know that. So it just really helped me out. So as I keep going and keep asking him to help me, I also remember that I have to be kind to these people as well, because they're scared as much as I am, because this is so new, and for them to have it is just totally crazy. Oh, sorry, that's my alarm going off. But I mean, they're scared. There are people that they just want to go home. They just want to be able to see their loved ones, see their like kids and all that, and to tell them, unfortunately, you have to stay here for a bit. Yeah, I mean, that's really hard. It's tough. And I've had to several times like reorientate a patient back to one of the rooms because they had dementia and they had COVID. So that was really scary. Like having a person walk around spreading the disease when we didn't want that. We had to like quickly gown up and be like, Mr. Sir, you have to go back in your room, that sort of thing. I mean, there's just close calls like that. And there's just a lot that we have to go through. And we have a great team of nurses and doctors. So it really makes a difference there. And I would say that the biggest thing that I learned was that I have to be kind to these people because they just need it. And that's basically all I can say about that. I mean, I really love what I do. I love my job, and I just get this opportunity to help these people. And I just hope that they see that what we're doing helps them to be more kinder.
It sounds like you've actually gone through a very similar experience with me working with people in the shelter, in the isolation shelter. People are the same, especially when they're facing something like COVID.
Yeah, exactly, because you're right up in their faces. Yeah.
So like we both experienced that, being staff and going into it's kind of like a war zone. Like you just don't know what's going to happen. You don't know if you're going to get it. You don't know how sick you're going to get. You're in your case, you've not gotten it, but there isn't that anxiety in you. You don't want to bring it back to your home and family and friends and stuff like that. So but then you got to deal with people that are actually have it and they're dealing with that anxiety, and they're not always on their best behavior because they're struggling with all these emotions, and some of them are scared probably to death. And some people are actually like, they can't get a hold of anyone, or they're lonely and all these different things. So it's challenging.
Yeah, precisely. I mean, it's just the fact that they're just in this situation and they can't go home, and just telling them just to hold on a bit. Some of them can't even hold on. So, I mean, it's just the most, the most isolating feeling ever. And
Yeah.
for you, you're at home in an RV, safe, and you're within feet away from your family, which is good. But you have to stay in that RV so that you don't spread the virus. So definitely.
Yeah. Yeah. Yeah, it's been quite the experience. So how long has it been going on where you've been working?
Well, since the pandemic started, it's been going on since then, and thankfully we've had a lot of good resources to help us. Like we've had free parking, the physicians bought us food to help us through it. So there's just been so much support, and people have been like sending us cards, and it's just really, really helpful. Like boosts our morale. So it's been really helpful for these times.
Yeah. So when was the outbreak for you guys? Like for us, we had ours basically right around Christmas time, right at the end of Christmas. The 31st is where Chilliwack really had its big outbreak. How about Abbotsford? It was a bit before us, wasn't it? In Chilliwack?
Yeah, it was a bit before us, because when around March of 2019 was when they completely started locking everything down. So like at the start of the pandemic was when they started getting in tighter measures and making sure that most units were locked down and that they prepared all the precautions necessary. So it was just like at the very start of the pandemic. Yeah.
Yeah, we went through that too. But when did you start getting like the surge of clients coming in or patients?
Just 2 weeks after. Like,
oh, really? So you had them steady?
We had steady. We had at least when it started, we had at least 20.
Yeah. And didn't you have the mission prison? Did everyone get
that was insane. That flow of people from Mission, that totally wrecked it almost. It was just so bad, and we had to like call people on overtime and extra shifts, and some people were getting so burnt out because of it. Like it was that was a messy scene. We had at least 25 COVIDs that day. And
yeah, it's quite something. Like I've had a lot of friends that and you see stuff on Facebook where people are saying, oh, this is a farce, or it's not really that bad. Like it's just like the flu. But the thing that they don't understand is what happens to the resources, the healthcare services, all that kind of stuff. It just gets thrown upside down when you have 30 people come to your ward with a very transmittable disease. And,
absolutely.
And everything changes. So, and it gets overwhelming very quickly. So we've dealt with that too in my workplace, just not enough staff and not enough manpower. So people working way too many hours and getting burnt out, stressed out, major anxiety and all those other things. So
definitely. Sorry, I'm just watching my son there that he doesn't go into any rooms there.
Okay, cool. So you've had the benefit of actually getting both your immunizations now.
I did. I had it after the 35th day. They just wanted me to hold on to a card that had the record of the first one, and then I had my second one 2 days ago. So it did give me that protection, and I only felt just a minor soreness on the opposite arm. They gave me the shot right here, but then I just felt this like sort of soreness right here. But then I know it's right because I'm mostly right-handed, and after a few hours, the soreness went away, but it just felt like this sort of like, like when you like stand up and you feel like air popping, that sort of thing. But it was just slight soreness. Yeah.
So nothing weird. You didn't grow an extra nipple or anything, or
no, not yet. No.
I know a lot of people are kind of scared of getting the vaccine.
Yeah, like if they're gonna like grow a tail or superpowers, I don't know. But
or if there's a chip in it or something.
I know. Yeah. I mean,
the mark of the beast
there's
or something.
Yeah, I know. Yeah, exactly. But no, it's safe. I even checked the vials. There's like nothing in them.
You did. You were wondering about that chip, eh?
Well, yeah, like exactly. Like, did they make it so clear? Like, shouldn't be afraid of the vaccine. I mean, it's there for a reason. It's to give you antibodies to fight it, and it'll save lives. And I mean, I don't want to call people ignorant, but I just want to just let people know I'm no medical expert. I'm just a guy that has a family that has to work for them and just take care of them. And I just wanted to do it because I'm thinking about them. I'm thinking about my wife. I'm thinking about my son. That's why I took the vaccine.
Yeah. Yeah, I can't wait till I get to. Apparently, I've got to wait a while now. So my workplace, everyone that didn't get COVID, a bunch of us did. They actually are getting it very shortly now. So because of the challenges that we work in. But apparently I can't get it for like a few months now. So I'm kind of...
Oh,
so hopefully I can't get it again because this has been
Yeah.
trying week.
Yeah. Well, I hope you do get expedited as well, because it's definitely.
Well, they have. It sounds like they've expedited our the shelter that we work for. So.
Okay, good. That's good.
Yeah, so that's good. So hopefully no more staff come down with it, because it's crippling too for the workplace, because you lose core staff. We lost 3.
Oh yeah.
And before, another shelter lost, I think, 12. So that's like a majority of their staff. So it is really challenging for the different workplaces. So
yeah, exactly.
Did you guys have any staff come down with COVID?
Thankfully, not where I worked. There were some units that did have people test positive, and they isolated right away. So where I worked, we thankfully didn't have any people that tested positive yet. So we were very fortunate. So no, we haven't had any possible exposures.
So you guys did a really good job, I guess, keeping yourselves safe. I still can't figure out what I did.
Yeah.
I have no idea how I got it. Like, I was so careful.
Yeah. No, totally. I totally get it. And it's just tough when you do the proper precautions and then it still happens. So
yeah. Cool.
But the last thing I want to say is that people just, to all those watching out there, I'm no expert. I'm not a doctor. I'm just a guy that is helping people out. So wear your masks, do social distancing, and just be kind to one another, because it's just so tough right now. And if people did that more, then there would just be less and less numbers. And even if it does happen to somebody, don't worry, help is on the way. So that's all I want to say. So yeah, for sure. Yeah, unfortunately, this gets spread usually when we have those events, even with family or things like that. And that's often where people you don't normally see or see only once in a while, and then it spreads. So it's really sad, because it affects like the family unit so much. So I don't know if my grandparents are over there, but I can't, or my parents, but I can't hang out with them. I couldn't hang out with them before, and I can't after, until this thing's done. Hopefully now that I have to do some more research, but I think I might be able to come into contact with people, because I can't spread it, but I'm not actually sure about that. Yeah, totally.
Look into that more. So.
Totally. Absolutely.
Cool.
Absolutely. So,
well, well, thanks for all your feedback and,
you're very welcome.
Yeah. Have you had many people that have really seriously gotten ill that you've had to work with? And how's that been?
Like there was this one ICU nurse that got really sick with COVID, and they've had symptoms for up to 3 weeks, and thankfully they did recover, but it was just a really tough haul, because they lost their appetite, lost their strength. I mean, they just felt the full effects, and right now this person is back to work again. So my wife is calling me, so
you gotta run
there, so gotta run. So thank you so much for having me.
All right, thanks for coming on. I really appreciate it.
Take care.
Yeah, it's great to hear from you.
Yeah, thank you very much.
Thanks.
Okay, see ya.
Well, thanks so much, everyone, for checking out Domingo's insight on what it's like to be a frontline worker in our healthcare system. Really appreciate all our healthcare workers, and Domingo's one of them that's right on the front lines doing care with the most vulnerable. If you enjoyed today's show, please like, subscribe, and hit that bell. And please share any comments you might have with me below in the comments section. If you have any questions or things you'd like us to discuss in future episodes, please share that there as well. Also, invite you to check out Domingo's YouTube channel. His link's in the bottom of the description there. He's got lots of great, insightful stuff that he can help you out with, so it's worth checking that out. That's about all we got today. Thanks for watching. Tomorrow I got special guest. I got a friend named Carrie who's a frontline nurse actually working in the ICU in Abbotsford as well. So stay safe, everyone. I'm Chris, and I have COVID-19.